So this category covers 17 to 23% of the NCLEX test plan. Say what? 17 to 23% of the NCLEX test plan. Hey guys, do you ever get really confused about the NCLEX? What's going to be on it? What am I going to be asked? Well, I'm Mary Mormon and I'm a nurse educator here at NRSNG, and I've been a nurse for over 10 years, and I want to help break down one of these categories for you for the NCLEX. So the category I want to talk about is management of care. So this category covers 17 to 23% of the NCLEX test plan. So this should also be a really highly asked category in your nursing courses also. So what is this? Management of care is described by the NCSBN as providing and directing nursing care that enhances the care delivery setting to protect clients and the healthcare personnel. Say what? I know, that's exactly what I thought. So basically all this is it's how to give the best, most effective care to a patient in the given situation, while keeping in mind patient safety and the nurse safety. So this is a lot of topics. So some of the big ones are going to be ethical things. So that'll be informed consent, just ethical situations, legalities, the client rights. Another big category is going to be prioritization, delegation. All of that falls into the management of care on this test plan. So it's how you're going to best care for a patient in a given situation, right? So I want to give you guys a tip for when you're taking your boards, for when you're taking these practice questions, for when you're taking your exams in school. I want you guys to read the question and do not read the answers. And I know that sounds crazy, but you need to focus on what the question's really asking. I can't tell you how many times I read those answers and the bad, wrong answers sounded so good and so right, and then you pick the wrong one. And then when you look back at it, you're like, that is not what this question was asking. So look at the question, think, what would I do in this situation? And then look for the answer that best matches that. This is going to really help your critical thinking too, so that when you're in a patient room, you're going to think, okay, this is what I should do, and you're going to do it. Because when you're in a patient room, you're not given an A, B, C, D, E, select all that apply to pick from, right? You just have to act. So I want you to read that question and figure out what best matches your answer that you think is right. For instance, if you have a patient that has chest pain, you're going to be wanting to assess that patient, maybe give some oxygen, right? You're not going to want to go get help. You don't want to leave that patient, but perhaps you want to do some of these things while you're calling for help. So just kind of think it through in your head. What would you do first to make it make sense? What's the best, most safest thing for that patient and for you in that situation? I want you guys to head on over to NRSNG.com, and I want you to look at our NCLEX test course. We have an NCLEX ebook that you can use. We have practice questions, and then you can also start a trial where you can go through and see all the courses. There's a test taking course. There's courses on anything you can imagine. All right, guys, now go out and be your best selves today. And as always, happy nursing.